Hi everyone, and today I will be talking about cessation services in community college. The definition of smoking cessation is to quit or stop smoking. Thus, cessation services include services that help interventions so someone may be able to quit or stop smoking. This could include counseling, drug prescription, or therapy. Some effective methods of smoking cessation are quoted to be behavioral support and medication, from Robert West and Sal Schiffman, authors of various assessments and smoking cessation books. The 2008 European Journal of Cancer Prevention also mentions behavioral support through group therapy, as well as bupropion, a drug which assists users in cessation. First, let's talk about DeAnza's health service in assisting smoke cessation. Calls to make an appointment for one-on-one counseling with an on-campus and now online counselor are available. Along with that comes an option to, with a counselor, make a personalized cessation plan depending on one's situation, mental health and physical health, as well as habits. There is also readily available free nicotine replacement, including patches and gums in their clinic, accessible to all students. Unfortunately, now, due to the pandemic, these services seem to no longer be available online. It is also important to mention that DeAnza, even in the health services website, regards themselves as a smoke-free campus. DeAnza also has tobacco initiatives which could be seen around campus. Flyers, for example, about the harms of e-cigarettes like Juul or vape has been actively discouraged and amplified in tobacco discussion these days. These flyers are placed in places with much foot traffic in the library and the hall below the canteen. While the Health Service Department used to promote cessation services actively in Club Day from 2016 to 2018 through giveaways and events, they now seem absent in promoting them. Posters about the harms of tobacco have been present in the Student Council Hall. In the International Students Orientation, locations and availability of these services has been mentioned and heavily encouraged. DeAnza has had updated website information regarding the availability of their cessation and counseling services, which I later found out to be quite rare in regards to other colleges. Now speaking about other community colleges. The 2017 research titled Tobacco Control in Community Colleges say that 45% of smokers state that quitting smoking would have no or only a minor impact to their health in community colleges. There seemed to be a little agreement with the scientific data already widespread in the general public regarding the significant repercussions of smoking to health. The research also found that community colleges have a higher at-risk population compared to 4 years, which include categories more likely to smoke, regular smokers, and failed at quitting. The reason for this could include diverse demographics of people that come to community colleges, from adults going back to study, veterans, and more. Something else noted in the research is also that there are many available tobacco control literatures in many community colleges. However, it is also noted that they have very little student traffic and reading of the literature. Also, more than half, about 58% of two-year community colleges lack student health centers, and thus cessation services in the first place. In comparison to other 2 years perhaps, we could say that DeAnza's cessation services are better than other colleges. Now I will speak regarding what is needed both in DeAnza and other community colleges. First, based on a study in Nottinghamshire, England, with a sample space of 6,865 people, proactive identifying is needed. Proactive identifying smokers who want to quit and referring them to cessation services increases their contacts with cessation services and the number of quit attempts. Smokers in the intervention group were more likely than controls to report that they had used local cessation services during the 6-month study period, 16.6% and 8.9% respectively. And continuing smokers in the intervention group were more likely to have made a quit attempt in the last 6 months. That is 37.4% and 33.3%. Other initiatives needed could be seen in what Ohlone College has done in 2005 with their 100 People, 100 Days program, which increased the numbers of students seeking cessation services. This event includes staff members to be mandatorily involved in promoting, whether through spreading a required number of handouts to students regarding available cessation services on campus, wearing a promotional t-shirt of the program, or using mugs with the initiative's name. Further initiatives could include the use of cheaper services, as colleges may not be able to afford on-campus or readily available counselors as DeAnza does. A feasible approach for future initiatives could include testing low-cost technology, such as web-assisted tobacco interventions, WATI, and outside partnerships with community organizations and health agencies. Thank you.